Hey everybody, Dr. Nick Scala with River City Physical Therapy, located right here in the heart of Jacksonville. Today I want to talk to you about a common condition seen in people with hip pain, and we're going to talk about the three most common signs and symptoms of this condition, and that is hip arthritis or hip osteoarthritis. And that's usually characterized as a pain or stiffness in your hip joint itself. Now, one of the first things you need to look at is where exactly do you experience your hip pain? Do you experience it in the groin? Do you experience it in the back of the hip? Do you experience it in the side of the hip or the front of the hip? Because with hip arthritis, usually people experience hip pain in the front of their hip and on the side of their hip. And in worst case scenarios, it may travel down their mid-front thigh. So typically people with hip arthritis have pain in the front and side of their hip. Another thing that you need to consider with this condition is your age. Researchers have found that if you're the age of 50 years and older, your likelihood increases that your hip pain is related to hip arthritis. So again, if you're in that middle age group and you're a little bit older and you're a little bit more active and you have hip pain, it could be related to hip arthritis, and that's a sign that you need to look out for. Another symptom and sign that you should be wary of is when you first get up in the morning and you take a few steps and you're getting your coffee ready, getting your breakfast ready, and your hip is kind of a little bit painful and a little bit stiff, but within the first hour of you being up, it kind of goes away. That's a sign that you might have an arthritic hip joint. So pain that does not persist past an hour with first getting up in the morning. So we're going to write that down as something that you want to look out for. So just to recap a little bit, you'll have pain in the front side of your hip, and that's during weight-bearing activities, whether that be walking, running, or just standing there. Usually you will not have pain when you're sitting down. Usually this condition is seen in people who are 50 years and older, and usually another sign that you need to look out for is pain that doesn't last past an hour in the morning. So you have stiffness or pain in the morning, but it doesn't last past an hour. Now this condition is very common, especially in the active and fit 50 years and older. And it can often get in the way of your exercise routine, your gym workout, and even playing with your kids or grandkids if you have any. So it can be debilitating, but it is something that's treatable without medications, injections, or surgery. You just have to know what correct flexibility and strengthening exercises to do that work best for you. And once you implement a routine, that's going to get you back to exercising pain-free, running pain-free, walking pain-free, and playing with your kids and grandkids pain-free. So if you have some of these signs and symptoms and have maybe had failed treatment before or aren't sure what to do, give us a call at 904-566-7070, and we'll talk to you about what your pain is keeping you from doing and see what can be done to get you back to living life pain-free. Look forward to hearing from you soon.